Welcome to our exploration of traditional, complementary, and alternative medicine, where we'll look beyond mainstream care to understand diverse healing traditions, their histories, and how they can work alongside modern medicine to support whole person health and well being. This chapter introduces the landscape of TCAM, explaining key terms and setting the stage for why these healing systems matter today, and how they fit into global health conversations and clinical practice.
When we talk about traditional medicine, we mean nature-based remedies and culturally rooted practices passed down through generations, often focusing on restoring balance between mind, body, and environment rather than treating isolated symptoms.
Complementary therapies are used alongside standard medical care to support healing, while alternative approaches replace mainstream treatments. Today, we'll clarify the distinction and why integration and patient safety are so important. Integrative medicine aims to combine the best of both worlds, evidence-based complementary therapies blended with proven conventional treatments to provide whole-person care focused on prevention, lifestyle, and sustainable well-being.
This slide highlights how ancient healing wisdom is now being studied with modern scientific methods, bridging thousands of years of practice with contemporary research to better understand mechanisms, safety, and effectiveness.
TCAM matters because it plays a vital role in primary care for many populations, is recognized by most member states, and represents a large global market. All signs that traditional and complementary medicine are significant drivers in global health.
Chapter 2 turns to historical roots and global perspectives, tracing how diverse healing traditions developed over time and how they continue to shape health practices around the world.
Traditional medicine around the world takes many forms. Ayurveda in India emphasizes personalized herbal and lifestyle medicine. Traditional Chinese medicine balances qi with acupuncture and herbs, and indigenous practices draw on spiritual and natural knowledge tailored to community needs.
The evolution of CAM in the West shows gradual shifts from homeopathy and naturopathy in the 1800s to body-based practices in the early 1900s, growing public interest in the late 20th century, and increasing integration into mainstream healthcare from the 2000s onward.
The WHO Global Traditional Medicine Summit in 2023 was a landmark gathering that advanced international collaboration, established a global center, promoted research networks, and strengthened standards for safety and evidence-based integration.
A world map reminds us that traditional healing systems exist across every inhabited continent, each reflecting local ecosystems, cultures, and approaches to health, which together form a rich mosaic of global healing knowledge.
Chapter 3 introduces the major domains of complementary and alternative medicine, from mind-body practices to biologically based therapies, bodywork, energy medicine, and creative therapies, offering multiple pathways to wellness. Mind-body medicine includes practices like meditation, mindfulness, yoga, and Tai Chi, which reduce stress and improve mental clarity. Techniques like hypnosis and biofeedback also harness the mind's influence on physiology to support recovery and pain management.
Biologically based practices focus on plant medicines, dietary supplements, and nutrition therapies, using centuries-old herbal knowledge alongside modern nutritional science to support health, prevent deficiencies, and manage specific conditions.
Manipulative and body-based practices such as chiropractic care, osteopathic manipulation, massage, and reflexology work to optimize musculoskeletal alignment, improve circulation, and enhance the body's natural healing capacity through skilled hands-on techniques. Energy medicine encompasses methods like Reiki, Qigong, and certain electromagnetic therapies based on the idea that subtle energy fields influence physical and emotional health, and many practitioners blend these with other modalities for balanced care. Senses and creative therapies use art, music, guided imagery, and dance to process emotions, reduce stress, and support rehabilitation by engaging creative expression and sensory experience as therapeutic tools. This slide summarizes how CAM presents a broad spectrum of healing modalities, each offering unique pathways to wellness that can be selected and combined according to individual needs and clinical goals.
Chapter 4 moves into scientific evidence and the challenges that arise when studying complex, individualized CAM interventions within conventional research frameworks.
Evidence-based CAM is gaining traction through clinical trials, with proven therapies like acupuncture for chronic pain and mindfulness for anxiety showing effectiveness, while ongoing research seeks to clarify mechanisms and best integration practices. Research on CAM faces challenges such as variability in practice, difficulties with placebo controls, the individualized nature of many therapies, and the need for long-term studies to demonstrate sustained benefits and safety. Safety considerations are critical. Herb-drug interactions, inconsistent product quality, the risk of delayed conventional treatment, and practitioner competency all require careful attention and open communication between patients and providers. Regulatory landscapes vary widely, with differences in practitioner licensing, product classification, quality control measures, and international efforts to harmonize safety standards for herbal and complementary products. A chart of rising research investment shows a substantial global increase in CAM clinical trials over 2 decades, reflecting growing scientific interest and funding for rigorous investigation into these therapies.
Chapter 5 examines how integrative medicine is applied in clinical practice, combining evidence-based CAM with standard care to improve outcomes across a range of conditions.
Integrative oncology highlights how acupuncture and supportive therapies can dramatically reduce chemotherapy-induced nausea, improve quality of life, and support patients through treatment when used under medical supervision.
Pain management through integrative approaches often uses multiple modalities together: physical therapy, chiropractic care, acupuncture, massage, and mind-body techniques to reduce reliance on medications and enhance functional recovery. Mental health applications of CAM include mindfulness-based stress reduction for depression and anxiety, body-based therapies for trauma, and biofeedback or hypnosis for anxiety disorders, all aimed at improving emotional regulation and resilience.
Chronic disease and wellness strategies use nutritional supplements, lifestyle coaching, and preventive approaches to manage conditions like diabetes and cardiovascular disease while emphasizing root cause treatment and long-term health promotion. Patient-centered care in integrative medicine emphasizes respect for cultural beliefs, shared decision-making, open communication, and personalized treatment plans, with the goal of improving adherence, satisfaction, and overall outcomes. This slide underscores the idea of bridging conventional and complementary healing systems to create a more holistic and patient-focused approach that draws on the strengths of both traditions.
Chapter 6 explores popular CAM therapies in greater depth, showing how ancient practices are adapted and validated for modern clinical use.
Acupuncture is an ancient Chinese practice using fine needles at specific points to modulate nerves, muscles, and connective tissue, and modern research supports its effectiveness for many types of chronic pain and certain other conditions. Herbal medicine acts as nature's pharmacy, with Ayurvedic, Chinese, and Western herbal traditions offering plants like triphala, ashwagandha, ginseng, ginger, echinacea, and St. John's wort for various therapeutic purposes, while quality and safety remain essential. Mindfulness and meditation provide proven neurological benefits such as reduced stress hormone levels, increased gray matter in key brain regions, and improved emotional regulation, which helps explain widespread adoption across schools, workplaces, and healthcare settings. Chiropractic care and osteopathy focus on spinal and structural alignment to treat musculoskeletal conditions and often complement other rehabilitation approaches, though evidence varies by condition and claims should be evaluated critically. Massage therapy and bodywork support circulation, reduce muscle tension, aid rehabilitation after injury, and activate the parasympathetic nervous system to promote relaxation and recovery, making them valuable components of integrative care. This page emphasizes plant medicine as both an ancient art and a modern science, reminding us that herbal remedies are among the oldest and most diverse healing traditions known to humanity.
Chapter 7 shares patient stories and real-world impacts to illustrate how integrative approaches translate into meaningful improvements in people's lives.
A case study of an integrative approach to cancer care describes a supportive protocol combining acupuncture, meditation, gentle yoga, and nutritional counseling that led to marked reductions in nausea and improvements in mood, sleep, and a sense of control. A chronic pain success story highlights how a multimodal program including yoga, therapeutic massage, chiropractic care, and mindfulness helped a patient reduce opioid use by half and regain functional abilities over several months. A mental health transformation example shows how adding hypnotherapy and mindfulness to conventional care helped a veteran with PTSD significantly reduce symptoms and reconnect socially, demonstrating the potential of integrative mental health interventions. Global health impact emphasizes that in many regions traditional healers provide the majority of primary care, offering culturally appropriate, accessible options where conventional services are limited or unavailable. Real people and real results capture the core message that integrative approaches aim to treat the whole person and often produce meaningful improvements in quality of life, not just symptom relief.
Chapter 8 looks forward to future directions and innovations, exploring how technology, research advances, and policy changes will shape the next era of TCAM.
Digital health and AI are increasingly applied to TCAM through AI-powered diagnostics, personalized herbal prescriptions, telemedicine making practitioners more accessible, and digital therapeutics delivering scalable mindfulness and behavior change programs. Advances in research methodologies include pragmatic trials, comparative effectiveness studies, biomarker research, and systems biology approaches better suited to evaluating complex, personalized CAM interventions in real-world settings. Education and training are expanding with more academic programs, standardized curricula, certification systems, and continuing education to ensure practitioners meet competency standards and stay current with evolving evidence. Policy and global collaboration are driving initiatives like the WHO Global Center, international standards for product quality and practitioner qualifications, evidence synthesis networks, and efforts to preserve health equity and traditional knowledge. Sustainability and ethical sourcing are critical as overharvesting and habitat loss threaten medicinal plant species. Solutions include cultivation of threatened plants, fair trade practices, community conservation, and DNA barcoding for authentication. This slide reiterates that innovation can meet tradition. By integrating new technologies and rigorous science with time-honored practices, we can enhance safety, effectiveness, and accessibility of TCAM.
Chapter 9 focuses on practical guidance for navigating TCAM safely, emphasizing informed decision-making, transparency, and collaboration between patients and conventional providers.
Tips for patients stress full disclosure to healthcare providers about any therapies being used, verifying practitioner credentials, researching evidence with reputable sources, and avoiding delays in necessary conventional care. Questions to ask your practitioner include inquiries about training and licensure, realistic risks and benefits, how the therapy will integrate with current treatments, and the expected cost and duration of care to make informed choices.
Reliable resources for information include organizations like the National Center for Complementary and Integrative Health, WHO's Traditional Medicine Portal, and academic consortia that publish evidence-based guidance free from commercial bias.
Partnership in healing reinforces that open communication and shared decision-making between patients and providers are essential for safe, effective integrative care and for aligning treatment plans with personal values and goals. Chapter 10 offers a summary and call to action, inviting listeners to stay informed, encourage collaboration, and support approaches that honor both tradition and scientific rigor for better health outcomes. The promise of TCAM lies in holistic care that addresses physical, mental, emotional, and spiritual health, in greater global access to culturally respectful care, and in growing evidence that supports safe integration with conventional medicine. In closing, embrace a future of integrated healing by staying informed with reliable sources, fostering collaboration between conventional and traditional practitioners, and working to improve outcomes through systems that respect diverse healing traditions while upholding patient safety and scientific standards.